Thank you. And now it is time to recognize the 2017 Duke University Master of Science in Global Health graduates.
We ask that you please hold your applause until the end. Koi Adewumi. Koi's thesis focused on identifying providers to deliver a caregiver-mediated early autism intervention in South Africa. Her mentor was Lauren Franz. Martha Berg. Martha conducted a mixed method study among Nepali adolescents to identify cultural concepts of negative emotions. Her mentor was Brandon Court. Matthew Boyce. Matt's thesis focused on the use and limitations of malaria rapid diagnostic testing in Western Kenya. His mentor was Wendy O'Meara. Yujung Choi. Yujung conducted a cross-sectional study of pediatric HIV disclosure in rural Zimbabwe. Her mentor was Eric Green. Denali Kanhawa Dahl. Denali's thesis examined the concordance between the pocket colposcope and standard colposcope for cervical cancer diagnostics in Peru. Her mentor was Nimi Ramanujam. Dina El-Gabri. Dina conducted a mixed method study on the perceptions of and behaviors relating to drinking and drunk driving in Moshi, Tanzania. Her mentor was Catherine Staten. Daniel Roland Evans. Daniel's thesis examined mosquito biting patterns and efficacy of insecticide-treated nets in Webuye, Kenya. His mentor was Steve Taylor. Hiba Fatima. Hiba conducted an exploratory search for novel coronavirus of zoonotic origin in Sarawak, Malaysia. Her mentor was Gregory Gray. Olivia Fletcher. Olivia's thesis explored attitudes toward alcohol use during pregnancy among women in alcohol-serving venues in Cape Town, South Africa. Her mentor was Melissa Watt. Shuvomita Happy Ghosh. Happy is studying the timeliness of childhood vaccinations in Tanzania. Her mentor is Lavanya Vasudevan. Hanati Hailati. Hanati explored traditional umbilical cord care practices among Taru people in Nepal. His mentor was Jeff Moe. Taylor Margaret Haynes. Taylor's thesis examined individual and family-level predictors of child mental health outcomes in Eldoret, Kenya. Her mentor was Eve Puffer. Hong Jiayang. Jiayang did his fieldwork in Ecuador and India and is conducting a systematic review of articles claiming cost-saving results for chronic disease interventions in Singapore. His mentor is Eric Finkelstein. Joseph Incorvia. Joe conducted a mixed method analysis of barriers to surgical care in Uganda. His mentor was Michael Hagland. Adriana Line. Adriana conducted an ecological analysis of hospitalizations for primary care sensitive conditions under Brazil's family health strategy. Her mentor was João Visosi. Cesar Lubangakene. Cesar's thesis explored private health providers' perception of challenges and opportunities in providing maternal and neonatal services in Uganda. His mentor was Regine Preschold-Bell. Elizabeth Monahan. Elizabeth's thesis evaluated the effectiveness of permethrin and deltamethrin in the northern Peruvian Amazon. Her mentor was Bill Pan. Thomas Christopher Moore. Tom's thesis explored tick-borne pathogens circulating in Mongolia. His mentor was Gregory Gray. Luis Nyanya. Luis's thesis focused on sex differences in modifiable risk factors for atrial fibrillation in Eldoret, Kenya. Her mentor was Jerry Bloomfield. Shem Opalat. Shem studied the economic burden of patients seeking neurosurgical care in Kampala, Uganda. His mentor was Michael Hagland. Devin Paul. Devin's thesis examined the correlation of exhaled nitric oxide and asthma diagnoses in Western Kenya. His mentor was Peter Kusin. Laura Pulsher. Laura completed a cross-sectional study of small mammals for tick-borne pathogen infection in Mongolia. Her mentor was Gregory Gray. Yudong Qian. Yudong conducted a clinic-based survey investigating oral health-related quality of life, oral hygiene habits, and nutritional intake among elderly Singaporeans. His mentor was Truls Ostby. Rebecca Rice. Rebecca completed her fieldwork in Haiti, and her thesis studied methamphetamine use and predictors of contact with the criminal justice system in Cape Town, South Africa. Her mentor was Christina Meade. Michelle Roberts. Michelle evaluated stakeholder perspectives on patient experiences with transitional care after an acute neurological event in Argentina. Her mentor was Janet Betger. Andy Schmidt. Andy studied gender as a moderator of coping mechanism selection in the context of a school-based mental health promotion program in Nepal. Her mentor was Brandon Court. Jihei Suk. Jihei's thesis assessed knowledge and attitudes towards HIV and people living with HIV among public health midwives in Sri Lanka. Her mentor was Truls Ostby. Daphne Wei-Shun Wang. Daphne evaluated determinants of self-efficacy for management of chronic diseases in North Carolina. Her mentor was John Stanifer. Leah Watson. Leah's thesis identified family-level predictors of caregiver mental health in Kenya. Her mentor was Eve Puffer. Alexandra Whitcomb. Alex conducted human-centered design research in Kenya to develop and improve a new mobile phone service that connects interested women with family planning providers. Her mentor was Eric Green. Please join me in congratulating our graduates.